Tramadol is a medication that can be given to you to control pain. It is a centrally acting analgesic and classified as a synthetic opioid. It is not derived from the natural opioids like morphine. Even though it is a synthetic opioid, it can still act on the opioid receptors as an agonist. This can reduce pain sensation. However, just like morphine, tramadol can also produce addiction and dependence. Therefore, its use is limited to controlling pain that is not relieved by other medications. In the children, tramadol can produce respiratory depression. Therefore, in the children with ages under 12 years, it is not recommended. Even in the young and adolescent people with ages less than 18 years, it should be used with care. In this video, let's explore all such interesting facts about this medication. First, let's see how it works. Tramadol acts on your brain, and it acts just like the other opioids like morphine. However, it is a synthetic opioid. The activity of this medication depends on two factors. First, this medication itself can produce analgesic activity, and second, it can be converted into its active metabolite, which is more potent and 200 times more active than tramadol. Both tramadol and its metabolite can bind to the mu-opioid receptors in your brain, which increases the analgesic activity. Normally, the pain transmission is controlled by a few neurons called nociceptive neurons. They can sense the pain stimuli, and they can send the information to your brain, where you can perceive pain as a response. However, this transmission of pain signal can be controlled by use of tramadol. It can bind to the mu-opioid receptors, which opens the potassium channels. This results in hyperpolarization of the neurons supplying the pain. This reduces the pain transmission. How to take this medication? Tramadol is given to you whenever other analgesics are not working well. It is available under prescription only. Since it causes addiction and dependence, it should be used properly for the right purpose. Tramadol is available as immediate-release tablets, as well as extended-release tablets or capsules. Both are not equivalent. Tramadol should be started at a very low dose. Immediate-release tablets are available at 50 milligrams and 100 milligrams doses. Extended-release capsules are available from 100 milligrams to 300 milligrams. Initially, it started at a low dose of 25 milligrams that is given every morning. This dose can be slowly increased up to 100 milligrams. The maximum dose should be less than 400 milligrams per day. In the case of extended-release tablets, it can be given as 100 milligrams once daily initially. If it is required, the dose may be increased, but the maximum dose should be less than 300 milligrams per day. The extended-release tablet should not be crushed or chewed. It should be taken as a whole. Effect of metabolism. Tramadol is metabolized in the liver, and it is excreted in the urine. The metabolism of tramadol is mediated by the cytochrome P450 system. Tramadol is extensively metabolized in the liver through CYP2D6 and CYP3A4. One of the active metabolites of tramadol is formed by the action of the CYP2D6 enzyme. Any polymorphism in this enzyme may produce variable effects in people. Particularly in the children, this variability can be observed. Few children may act as rapid metabolizers due to enhanced activity of CYP2D6. With increased activity of this enzyme, tramadol is more converted into its active metabolite, which leads to respiratory depression. Other medications that affect the activity of these enzymes may impact the metabolism of tramadol. For example, if you take CYP2D6 inhibitors like amiodarone and quinidine along with tramadol, they may reduce the metabolism of tramadol and increase its plasma levels. This decreases the levels of active metabolite, thereby precipitating symptoms of opioid withdrawal. Central depression. When you take the tramadol with other CNS depressants, the sedative effects may be more enhanced. For example, when you combine the tramadol with benzodiazepines, you can observe profound sedation and respiratory depression. Therefore, benzodiazepines may be avoided. If you're already taking benzodiazepines and you're going to initiate the tramadol, you have to take the tramadol at a very low dose in order to avoid sedative effects. You may also have respiratory depression. Therefore, a higher dose of tramadol should be avoided. Similarly, when you're taking the skeletal muscle relaxants that are acting centrally, they can also produce profound sedation, dizziness, and lightheadedness. They should be carefully used with tramadol. Use of tramadol with other CNS depressants like anesthetic agents, antipsychotics, Phenothiazines, sedatives, and hypnotics may also increase the risk. A similar effect can also be observed with high intake of alcohol. Alcohol can produce significant sedation and drowsiness when you take it with tramadol. Tramadol can alter your alertness, and it can induce some drowsiness and sedation. Therefore, while you are driving a car or operating machinery, it may reduce your mental and physical abilities. Therefore, you should be careful until you feel comfortable and alert after a few days of its use. Serotonin syndrome. Use of tramadol can produce a condition called serotonin syndrome. This results in the elevated levels of serotonin in your brain. Normally, this condition can be observed when you take tramadol with other medications that increase the serotonin levels. Medications like selective serotonin reuptake inhibitors, serotonin and norepinephrine reuptake inhibitors, tricyclic antidepressants, and new antidepressants like mirtazapine and trazodone may increase the serotonin levels. Therefore, when they are combined with tramadol, they can produce serotonin syndrome. It results in a few symptoms like agitation, hallucinations, increased heart rate, elevated body temperature, and muscle incoordination. Therefore, be cautious in using other medications while taking tramadol. Use in pregnancy. When tramadol is given to the pregnant woman, it can produce respiratory depression in the newborns. Prolonged use of tramadol during the pregnancy can also result in the withdrawal effects in the newborns. Therefore, only whenever benefits outweigh the risk, this tramadol should be used. When to avoid. If you have any gastrointestinal obstruction, use of tramadol is not recommended because it can reduce gastric motility. It's also contraindicated in people with severe bronchial asthma, as it can produce bronchoconstriction. Other effects. Use of tramadol may produce some sleep-related breathing problems. You may have sleep apnea and sleep-related hypoxemia. If you're taking the tramadol for greater than 1 month, you may observe few symptoms that may be associated with adrenal insufficiency. So if you observe any such symptoms, supportive therapy like corticosteroids may be used. Tramadol can produce orthostatic hypotension, and it may result in syncope in a few people. If you have any signs of hypertension, you should carefully use this medication. Use of tramadol can reduce your blood glucose levels. This leads to hypoglycemia, which is more pronounced in people with diabetes. So if you have pre-existing risk factors for hypoglycemia like diabetes, you should use tramadol with care. Tramadol can produce a condition called hyponatremia, loss of sodium from the body. This effect is more pronounced in the woman with an age above 65 years. It results in the loss of body fluids and may develop a few symptoms like confusion and disorientation. This hyponatremia can be observed within the first week of the therapy in the woman. Tramadol can increase the risk of seizures in the people. So if you have any history of seizures or any risk factors, like if you're using other medications like TCAs, SSRIs, or MAO inhibitors, the risk of seizures may be increased. In people with any recent head trauma, the intracranial pressure may be increased. In such people, tramadol should be carefully used, because tramadol can produce a depressant effect, which induces retention of carbon dioxide. This elevated level of carbon dioxide may produce an increase in the cerebrospinal fluid pressure. This can further increase the intracranial pressure. Therefore, in people with recent head trauma, tramadol should be carefully used. Paradoxical effects. Sometimes you may observe an increase in the pain intensity with the use of tramadol. It is a paradoxical effect that can be produced by this medication, particularly at higher doses. When you increase the dose, pain is going to be increased. You can also notice a reduction in pain on reducing the dose. This indicates a condition called hyperalgesia, which is a paradoxical increase in the pain sensation. It can be observed with overuse of tramadol. What are the withdrawal symptoms? On sudden withdrawal, tramadol can produce few withdrawal effects. When you stop this medication suddenly, it can induce a few symptoms that are just similar to the symptoms for which you're going to use this medication. Since tramadol can reduce the pain sensation on sudden withdrawal, you may observe elevated pain. As it causes sedation and drowsiness, you may observe insomnia and increased anxiety and sweating on sudden withdrawal. You may also have tremors, diarrhea, and respiratory symptoms. Therefore, never stop this medication suddenly, especially when you are higher doses. You should gradually reduce the dose over a few weeks. That's all about this medication, tramadol. Share your experience with the use of this medication in the comment section below. Thanks for watching. Have a great day.